So patients come to our office with tooth pain, and I'm going to show you a situation here where patients make an appointment with us because they have toothache in the third molar. I'll show you how we look at it as dentists and how we assess a tooth on an extraction. Now, first of all, what we have to do is make sure that we are taking an x-ray. One of the x-rays that we take would be what we called a Panorex. A Panorex looks like this, and where we are looking at a particular tooth in here, which is the third molar on the lower right, which is what we call number 32 when you go to the dentist. Lower right, third molar is the complaint that the patient have on this situation. Another x-ray that we take is what we call a Periapical X-ray, which will show that that tooth has a curved root, and what we have to do is plan on what happens if that tooth breaks right at the tip of the root. So we've got to make sure that we avoid having to retrieve that root if it breaks. X-rays that can be taken is what we call a bitewing. So you've got a bitewing and you've got a periapical, and the last one that we showed you was a Panorex. So we're looking at that tooth that we're going to pull out, assessing it with x-rays with a bitewing PA and a Panorex. And so what we're going to do first is let the patient know that we are going to pull this tooth out, and we're going to use the anesthetic. And by the time he goes home, make sure that he puts pressure on that tooth so that we could get the blood clot going at the end.